I stand here today with two fearless women who have led LA County through the coronavirus pandemic. This pandemic has forced us to show strength in difficult circumstances and to be flexible in every part of our lives. And trust me, I know that elected officials and public health experts have a lot of Angelenos who we've asked them to do a whole lot during the last 18 months. We've asked you to stay home. Early on during the pandemic, we've asked you to wear masks indoors in public spaces. We even limited the amount of time that you get to spend inside a grocery store shopping. So I know that I speak for many Angelenos when I say we are truly looking forward to returning to normal when the vaccines first came out almost 10 months ago. But now, 19 months after our first lockdown order, our hospitals are still filling up with COVID patients, but it's primarily the unvaccinated ones and entirely preventable. We have reached a point where the science has clearly spoken. Not only from the original thorough research and testing that was done before the vaccine was distributed, but through the experiences of millions of Angelenos who have now been vaccinated. When 391 million doses have been administered in the United States and 6.18 billion across the world, it's clear that vaccines work. But still, only 68% of LA County residents are fully vaccinated. So elected officials and public experts, what are we left to do? We've held vaccine events throughout the county and in the city of Los Angeles. We have access to vaccine centers throughout the city of LA. And we've even gone door to door with the shot to convince people that the vaccines are safe. The first round of vaccines to the public were offered in mid-December. That's almost 10 months later, and there's still so many people that are still not vaccinated. And the people who are playing by the rules, the people who have been vaccinated, deserve to go back to normal. It is unfair to continue to put everyone else's lives on pause because some won't listen to science, data, and the facts. As I've said it before, we're getting tired of protecting people who do not want to protect themselves and get vaccinated. And this is why today the City Council will take a vote on mandating vaccinations for indoor public spaces. We need both to limit transmission of the virus, as well as making sure that we do make it inconvenient for those who do not want to get vaccinated and want to have access to indoor venues, because they're putting people's lives in jeopardy. Because those who do not want to be vaccinated are truly doing that, actually putting people's lives in jeopardy, especially our biggest unvaccinated population, which are children under 11 years old. They're truly in jeopardy of getting sick. These kids have already given up too much. They gave up an entire year of school. They learned remotely through a computer. They're missing a year of socialization, and still, they're being put at risk because a person does not want to get vaccinated because they think they know better than doctors and scientists. And that's just not okay. This is why the City Council will take this vote today, because we have spent too much time placing restrictions on people who are doing their part in getting vaccinated and wearing their mask. We are thankful to our partner, the county, who took action to require vaccines in indoor spaces, such as bars and outdoor mega events, and I want to thank them for working with us in my office on putting and developing our ordinance for today's vote. Here in Los Angeles, we are expanding requirements. With our new mandate, individuals will need to show proof of vaccination by November 4th to enter a movie theater, gyms, restaurants, salons, as well as a handful of other places. Los Angeles is an inclusive city, and we want to make sure that those with religious and underlying medical conditions are respected. So if you have a medical and religious exception, you will need to provide a negative COVID test from the 72 hours before you enter an indoor space. This is no longer negotiable. The stakes are way too high. And if you want to have fun, go to a bar, eat at a restaurant with your family, or you're going to need proof of vaccination in order for you to do that. No one is forcing anyone to get vaccinated. But if you don't, there are certain things you will not be able to do without showing proof of vaccination. Angelinos deserve to see the other side of this pandemic. We deserve to be able to walk around without wearing a mask, without restrictions, and without fear. Now I'm going to say a few words in Spanish to our Spanish media. Esta pandemia nos ha forzado a todos a ser fuertes en circunstancias difíciles y ser flexibles en todo aspecto de nuestras vidas. Confía en mí que yo sé que los funcionarios electos y expertos de la salud pública han pedido mucho de los angelinos durante esta pandemia. Hemos pedido que permanezcamos en casa durante los primeros meses de la pandemia, usar máscaras cuando estamos en lugares públicos y limitar la cantidad de tiempo que pasamos en el supermercado. Pero ahora, 19 meses después de la primera orden de cuarentena, nuestros hospitales siguen con pacientes de COVID, pero principalmente las personas que no son vacunados, y esto es completamente inevitable. La primera ronda de vacunas para el público se ofreció a mediados de diciembre del año pasado, casi 10 meses después, y hay demasiadas personas que siguen sin vacunarse. Por eso este concilio hoy va a tomar un voto para mandato de vacunas para los lugares públicos adentro. Necesitamos limitar la transmisión del virus y hacer que sea inconvenible para las personas que no son vacunadas acceder a estos lugares dentro, porque están arriesgando las vidas de otras personas. Por eso es de que estamos tomando este voto en el concilio hoy. Estas personas están arriesgando no solo las vidas de sí mismos, pero de otras personas, especialmente la población más afectada, que son los niños menores de 11 años, que todavía no se pueden vacunar. Por eso esta ordenanza es tan importante. Hemos pasado mucho tiempo poniendo restricciones a las personas que han hecho de su parte y se han vacunado y usando las mascarillas. Estamos agradecidos con el público y estoy muy agradecida con el condado que ha tomado acción para requerir vacunas en espacios dentro, como cantinas, cervecerías, bodegas y otros mega eventos afuera. Aquí en la ciudad de Los Ángeles estamos expandiendo nuestro requisito. Con nuevo mandato, los individuos que elegibles para tomar la vacuna tendrán que comprobar por lo menos una dosis para poder acceder a lugares cerrados, por ejemplo, un cine, gimnasio, restaurantes y salones de belleza, nomás para nombrar unos cuantos. Los Ángeles es una ciudad inclusiva y queremos asegurarnos que tenemos consideración con las personas que tienen condiciones preexistentes, y si usted tiene una excepción de religión, también la queremos respetar. Si usted quiere tener acceso a estos lugares, tiene que comprobar que usted tiene un comprobante de una prueba negativa COVID entre los últimos 72 horas para poder entrar a ese negocio. Esto ya no es algo que podemos negociar. El riesgo es muy alto y si usted quiere divertirse, quiere ir a una cantina, quiere ir a un restaurante a comer con su familia, tiene que mostrar un comprobante de la vacuna. Nadie le está forzando que se vacune, sino habrá cosas que usted simplemente no podrá hacer. Todos los angelinos merecemos llegar al fin de esta pandemia, donde podremos regresar a una vida normal sin tener que usar mascarillas y sin tener que vivir con restricciones y tampoco sin tener que vivir sin temor. Muchas gracias. And now I'm proud to introduce a trailblazer and a fearless leader who represents LA County on our County Board of Supervisors, Supervisor Hilda Solis. Along with the Board of Supervisors, have been incredible, vital partners to the city of Los Angeles, to have to weather through this pandemic over the last 18 months. I want to introduce my friend, Supervisor Hilda Solis.
Thank you. What a complete honor it is to be here this morning, standing by Council President Nury Martinez, as well as our own Director of Public Health, Dr. Barbara Ferrer, who's really one of my heroes through this entire pandemic. I want to say that today we're at a very special mark in a new era to fight COVID-19. Since mid-July, the county has unfortunately been in a Delta-driven surge. And the surge, like the ones prior, have disproportionately impacted essential workers. And they are the people who continue to stock our grocery stores, our shelves, and when panic sets in, those are the people that are there to serve many. They're the ones who cleaned our hospitals. They're even the ones who were in the scariest places, seeing and facing other people's death. These residents work close here in our garment factories as well. They help to sew our masks that we wear. And tragically, they're the ones who have also endured the majority of COVID's consequences, from their children being out of the classroom to the hunger in their stomachs and the sickness and death brought on by COVID. And here we are today to prevent even more loss that COVID-19 brings to bear. We have 3 safe and effective vaccines that over 76% of the county residents have already received 1 dose. But we also have many residents who cannot yet get vaccinated, and those are the children under the age of 12. And although we hope to change that, we have a collective responsibility to protect each and every one of them. And that responsibility extends to all residents regardless of age. It extends to those in our restaurants working in the back of the house 7 days a week. It extends to old friends and meetings at local bars to catch up, and the list goes on. And that's why it's important we act to keep our public spaces safe. Starting next Thursday, October the 7th, in Los Angeles County, at bars, wineries, breweries, nightclubs, and lounges, proof of at least 1 dose of vaccination will be required to enter indoor spaces. And at outdoor mega events of 10,000 or more, such as sporting events, music venues, and theme parks, proof of full vaccination or a recent negative test will be required. This is on top of the state requirement that already has indoor events of 1,000 or more verifying vaccination or a negative test. This is a critical step and complements the ordinance that our city colleagues and our president here today have before them today. And I especially want to thank Council President Martinez for taking this action, and one that will save many, many lives. It's through her leadership that we're here today. First, it makes some of our areas that have the highest chance of spread significantly safer. And although we have seen that vaccinated people can have breakthrough infections and can transmit to others, we're also seeing that getting vaccinated greatly reduces the risks of doing so. This will create safe spaces in all of our communities, and it will allow people the freedom to go about their lives without fear of getting COVID. Our residents deserve this freedom, the liberty to enjoy the many benefits of this county, knowing that they are doing so safely. Data from around the world have shown that when similar policies were implemented, vaccination rates have increased. By making public spaces safer and increasing vaccination, we're adding 2 more layers of protection to keep all of our county residents safe. We'll be working hand in hand with our businesses to make sure that they have whatever resources are necessary to make sure that they are successful. It's this type of approach, working collaboratively, that has helped us keep our residents safe. And it's our path out of the pandemic. Now I will briefly make some comments in Spanish. Quiero dar las gracias a la presidenta del Consejo, Nury Martinez, por su colaboración y acción para combatir esta pandemia. También quiero reconocer los esfuerzos de nuestra directora de Salud Pública, la doctora Barbara Ferrer. Hoy estamos aquí para marcar una nueva era contra el COVID-19. Desde julio, el condado ha sufrido 9 olas de casos por la variante Delta. Esta ola, como todas las anteriores, tienen un gran impacto en nuestros trabajadores esenciales. Ellos sufrieron la mayoría de las consecuencias de este virus, pero estamos aquí para evitar más pérdidas de vidas. Tenemos 3 vacunas que son seguras y efectivas, y más de 66% de los residentes del condado ya han recibido la vacuna. Pero también tenemos muchos residentes todavía que no pueden vacunarse, y ellos son los menores niños de 12 años. Aunque esperamos que eso puede cambiar, tenemos la responsabilidad como comunidad a protegerlos. Por eso es muy importante que los espacios públicos están seguros. Empezando el jueves 7 de octubre, todos los bares, clubes y cervecerías en el condado van a pedir prueba de vacunación para entrar a lugares encerrados y eventos con 10 miles personas o más, como eventos deportivos y conciertos, van a pedir prueba de vacunación o una prueba negativa reciente del examen. Este es un paso crítico y quiero agradecer a la presidenta del concejal, Nury Martinez, por esta acción que va a salvar vidas. Este tipo de colaboración es lo que nos va a sacar de esta pandemia. Me da bastante gusto estar aquí hoy con ella y también con la directora de Salud Pública, Barbara Ferrer. Y con eso, muchas gracias. Barbara.
Thank you, Supervisor Solis, and we're very lucky to have with us today Dr. Barbara Ferrer. Dr. Barbara Ferrer has worked tirelessly to lead us through this pandemic with strength, diligence, in all her actions, leading the county public health. Welcome, Dr. Ferrer.
Buenos días y muchas gracias. Thank you so much, Council President Martinez, for inviting me here today and for your willingness to always step up and take those actions that keep all of us safe. Throughout the pandemic, LA City has benefited enormously from your extraordinary leadership and that of the entire Los Angeles City Council and Mayor Garcetti, always prioritizing the health and the safety of Los Angeles residents. I also want to recognize and thank Supervisor Solis and the Los Angeles County Board of Supervisors for their courageous and far-reaching efforts for 20 months now to protect the well-being of all LA County residents. The direction set by this group of exceptional elected leaders has made it possible for this very large city and county to continue on a recovery journey. And we're grateful for the bold actions contemplated today by the City Council to create more spaces in the city of Los Angeles where residents are protected from this deadly virus. Vaccination remains the quickest, safest, and most powerful way to decrease community transmission and prevent serious illness from COVID. And public health believes that targeted vaccination verification requirements are a most important strategy for creating safety at workplaces and entertainment establishments, and for increasing vaccination coverage. 2 weeks ago, as Supervisor Solis mentioned, LA County aligned with the national strategy and modified our county health officer order to require a vaccination verification or a negative test prior to entry to all very large outdoor events and event venues by October 7th. The modified health officer order also included vaccination verification for customers and employees in the indoor portions of bars, wineries, breweries, distilleries, nightclubs, and lounges. We do require that all customers 12 and older and employees have at least one dose of the vaccine by October 7th and are fully vaccinated by November 4th. I know there are lots of people out there that see our case rates decreasing alongside our dropping hospitalization and death rates, and they think we must be getting back to normal now. Why are we still pushing vaccines and living with mask requirements and even adding requirements like vaccine verifications? These are reasonable questions, and I think it's helpful in responding to these concerns to look at some of the information about what's going on in the rest of the country. Here in LA County, about 60% of our population is fully vaccinated. And as you know, masks are required of almost everyone in indoor settings, and vaccines are mandated for many people. Similarly, in New York City, 62% of the population is fully vaccinated. Vaccines are mandated for indoor dining, fitness centers, and performance venues. However, in Texas and Florida, 51% and 56% of the state's populations have been fully vaccinated, and state leaders have moved to ban mask and vaccine requirements in a variety of settings. When we look at the case rates between the examples, in the 2 weeks before September 18th, there were about 250 to 280 cases for every 100,000 people living in LA County and New York City. While in Texas and Florida, case rates were about 800 new cases per 100,000 people. That's about 3 times higher. And when you look at the mortality rates, here and in New York City, we saw between 4 and 2 deaths for every 100,000 people. Texas saw 12 deaths, and Florida saw 22 deaths per 100,000. This is 3 to 5-fold the number that we're seeing in LA County. Different case and death rates aren't just happening to us. They are a product of the collective actions we're taking. Businesses and people who live in different communities change these numbers when they adopt rules that add layers of protection against a deadly virus. This includes wearing masks, getting tested and vaccinated, and agreeing to live with restrictions that reduce opportunities for transmission in those settings that are high risk. In places where sensible steps have not been taken to reduce the spread of this virus, the Delta strain continues to ruin futures and take lives at a rapid pace. I'm mindful that all of this data is really us, and our individual and collective conduct makes a difference in the direction that our trend lines are taking. The reality is we're not back to normal. There remain too many opportunities for the virus to spread and for new variants of concern to take hold. And our pandemic history has now told us that we make the best progress when we actively take steps to reduce the spread of this virus. Until community transmission is low and vaccination coverage is much higher, prevention strategies are essential to our collective well-being and our economic recovery. Waiting until spread is high again before acting doesn't reflect the reality of this pandemic and the destructive potential of this virus. Let's continue to use every single tool we have to effectively reduce the risk of transmission and keep each other healthy and safe. And this is what Council President Martinez, the City Council, Mayor Garcetti, Supervisor Solis, and the Board of Supervisors are doing with targeted vaccine verification requirements, as they will position us to be better able to break this cycle of surges. Thank you so much, Council President, for inviting me to join you today, and I'm grateful for the actions you're taking today to protect the lives of everyone in the City of Los Angeles and in the county. Thank you.
Sure.
What about the impact on businesses? We're trying to come out of we're trying to recover here. You're going to rely on their workers to enforce this. Doesn't that put too much of a burden on business?
Sure, and that's a really good question. And we are working with businesses. In fact, we've done everything we can to work from the chambers to small business organizations to get their input as to what best practices we can put in place to make sure that not all the burden falls on their employees. And we've gotten really good feedback from them, so much so that there really hasn't been a whole lot of pushback on today's vote. So I look forward to continuing to work with businesses, but for the most part, they've really been very collaborative and incredibly insightful when it comes to figuring out how we're all going to partner in this. No one wants another economic shutdown. I think we can all agree that it's economically devastating for our city and for any employer or employee. So the last thing we want to do is to shut down any more businesses or have another round of a surge where we're having to make those calls. So businesses recognize that. And I think you're now seeing in the private sector what they're doing to mandate their own employees get vaccinated. So we all recognize we have to figure this out together. And they're definitely been a partner in this moving forward. Yeah. Hemos trabajado con negociantes y con comerciantes en la ciudad. Nos han dado muchísimo sugerencias de cómo podemos trabajar juntos y no hemos recibido muchas quejas o muchas preocupaciones aparte de los negociantes. Nadie quiere ver que nos vuelvan a cerrar negocios en esta ciudad. Eso es económicamente una catástrofe. Si tenemos que cerrar negocios otra vez, tenemos que dejar personas desempleadas o sin sus negocios, los comerciantes reconocen que la única manera de salir de esta pandemia es requiriendo las vacunas. Estamos trabajando con ellos.
Madam President, can you be more specific about my colleague's question on what you're doing with the small businesses? You said you're working with them. Can you give specifics on exactly what can be expected?
We've worked with the Restaurant Association, for example, for members of the Chambers of Commerce. We've had a small working group of individuals who actually lend their expertise about how this would all work. And we're working with the county in hand with their public health department to figure out the enforcement piece and all this. What we do not want to do is punish businesses. What we want to do is make it inconvenient for people to enter these businesses and have to force them to get vaccinated. What we're trying to do is limit the transmission of this virus. We're not trying to shut anybody down.
I understand that, but can you be specific on what you're talking about with these businesses that they will be expected to do to help enforce this?
The enforcement piece will have a partnership between the Department of Public Health and our Building and Safety Department. That is the enforcement mechanism that we have in place right now. We're giving ourselves a couple of weeks to work with additional businesses that need additional help and how they're going to implement this. Restaurants and bars are a little easier because some of the bars already all of our bars ask for verification of an ID, for example, if you're not 21 and older. So the other question will be, can we see verification of your vaccine? Have you gotten vaccinated? You can do that whether you present a physical card or my vaccine verifications on my phone, so I can do it electronically. But that's the specifics that bars, for example, gave us that sort of. They were okay with it because, according to them, they're already they're checking IDs already, so they're checking for vaccine verification as well. Yeah. I can't hear you. Why it doesn't include grocery stores and essential businesses? It's difficult, and I think pharmacies and grocery stores, gasoline stations, for example, or even when you're paying your utility bill, we wanted to be sensitive to the fact that these are essential services to people. We can't limit people from buying their groceries or going to a doctor's office or getting gas or fueling their vehicle. And so we want to be very careful and sensitive to that. So there is a number of retail spaces and businesses that we did not take into consideration because of the essential part of this. This is why they weren't shut down during the pandemic as well. People still need to go to the grocery store. They need to visit a pharmacy. They need to fuel their car and so on. No, they just need to prove, they should be given some sort of paperwork to get the exemption. Dr. Ferrer, did you want to?
Yeah, I mean, it depends on where you are, whether, certainly, it depends on where you are, what kind of verifications you're going to be showing at your business. For example, if you're an employee, there's going to be some kind of verification for those religious exemptions. But at retail establishments, really it's a self-identification. I have a religious exemption or I have a medical exemption, so instead I'm going to show you my negative test result. I mean, we've, in general, and I think the council president spoke to this, in general, enforcement of all of the health officer orders and the ordinances has been high rates of compliance by businesses and by residents. I mean, that is what we always rely on. People get good information. They think this is a sensible step. They want to be protected. Nobody wants to get sick with this virus. Nobody wants to die. And we move together in that way. Obviously, the same thing on religious exemptions. If you have a lot of cheaters, then this becomes problematic. But we've never had a lot of cheaters, ever. We've gone 20 months now with the vast majority of people doing what's right because what they're doing is taking care of each other. And that's really, this is a way to allow people who have these strongly held beliefs to be able to do something, but to add that layer of protection by getting tested so that we know that they're negative, not creating a lot of risk in a space.
Do you have a number in mind that when you hit that, then we can back down?
A number in mind?
Cases per 100,000. I mean, because you're issuing mandates, what's going to be the threshold to back down?
Yeah, it's a great question. I mean, obviously, the CDC has now set for the whole country the thresholds of what's low transmission, what's moderate transmission, what's substantial transmission, what's high transmission. You know, we'll feel very good when we get to low transmission. We just moved from high to substantial, so we got a ways to go before we're going to get to a place where we feel like there's not a lot of transmission.
Dr. Ferrer, your department has said gyms have among the lowest rates of compliance with mask mandates. So how are you going to get gyms to market their showcase vaccination?
Yeah. So I want to put that in context about, you know, sort of what's going on at the gyms and the fitness centers. They do have the lowest rate of compliance, but that low rate is at 85%. So I do want to say most of the gyms we visit, there's high compliance. Most of the bars we visited, very high compliance. Like people, in fact, factories, almost everybody, and this is on the indoor masking requirement, are doing their part. So again, for those places that don't, our inspectors are there providing technical assistance, helping them address whatever challenges they face and trying to get them in compliance. But you all know, after a few visits, if there's not compliance, there's the option, and we use it to issue citations.
Okay, guys, thank you. One more question, and then I have to start council in about 3 minutes.
The city ordinance goes further than the county ordinance.
Yes.
I'm curious about whether Dr. Ferrer would like to, whether she's concerned that this could cause confusion, and whether you'd like to see the county also do the stricter enforcement.
Yeah, so it's a great question about sort of the county has already moved in some spaces. These were the highest risk spaces to go ahead and make sure that we're getting extra layers of protection. And we're grateful for the City Council taking this step to add layers of protection in other places. Obviously, it takes a lot of work for us to be able to do all of the establishments that are covered by the City Council ordinance. We look forward to working with everybody in the city to make sure that this is implemented. If passed, it's implemented effectively, and we'll continue to work with them. So we're fully supportive of the city's efforts.